Do you have knee pain? Because if you do, this video is for you. I'm gonna go through the most common things that I see that go wrong with knees and the 3 things that I usually recommend to patients who are suffering with knee pain that gets results. I'm Dr. Matthew Posa. Welcome to my page. My page is dedicated to people and families with health tips and tricks so they can live the life they were designed to live. So don't forget to like, subscribe, and share this information with the people we know need it the most. The biggest issue that I constantly see in practice with knees is pain on the outside of the knee. And there's definitely a few different reasons for it. I mean, whether it's pregnancy or sporting injuries or hip problems or ankle problems, foot problems, there are muscle imbalances. There are a ton of reasons why people get knee problems. And we can literally spend probably hours just on this topic alone. But there's one thing that I constantly see here in practice that I know you're gonna benefit from. And the biggest thing that I see has to do with a weakness in a certain muscle, and more importantly, some drills or some techniques that you could do at home, a few easy exercises that are gonna help resolve the problem, and you should almost see the results immediately after doing it. As a chiropractor, there's a few things that I'm constantly looking for. I'm looking for pelvic instability. I'm looking for low back problems. I'm looking for ankle, knee problems. I mean, there's a ton of reasons, like I said, that people can be suffering with these knee issues, especially if you're an athlete of any kind, or maybe just the weekend warrior. But the biggest issue that I see is that there's a muscle that is way too overactive, and there's a muscle that isn't active enough. And there's a test that I want you to do at home. But if you got knee pain, you could also have disc problems. There's these 2 discs in your knees. And if one of those is being compressed, if the alignment is wrong, some people even have the knock knees where their knees are literally coming in together so they pigeon walk. There's so many reasons why somebody could have these problems. So number 1, get to a chiropractor. Make sure that in your area you have somebody that is an expert in not only joint mechanics, but an expert in spine, the nerves that travel down the leg, because a lot of the issues that I find, especially here in the clinic, is that people actually have nerve problems, and those nerves that go to your knee actually come out of your low back. So if we're not taking care of the source of the problem and all we're doing is treating the issues, well then at the end of the day it's just going to keep coming back. So that would be number 1. You could do something called a Thessaly, and right away, this is an easy thing that you could do. You're just gonna stand on one leg. And so let's take the bad leg. So let's say it's the right leg, and you're gonna stand on that one leg. What you're gonna do is slightly bend about 5 degrees, and you're just gonna rock back and forth. Now, if you can do that without pain, there's a high probability that it is not the meniscus. And that's what we're trying to rule out right off the bat before I get you to do anything. So make sure you're ruling out meniscus. Now, if that kind of hurts, you can also go to about 20 degrees. So you're going to flex a little bit more. And then again, turning side to side, really putting pressure through the meniscus. And we want to see, is the meniscus a problem? So if that's the case, then right away, if you do have the pain, that's what's causing it, then I would say stop, don't continue with this video, completely abandon, go see your doctor. You'll need some imaging done on your knee to make sure that the meniscus is okay. If there's clicking, popping, catching in the knee, then we're looking at other things. Those are things you need to discuss with your doctor or your chiropractor, because there's protocols, there's things that you're gonna wanna do that an exercise or a stretch simply won't do. So to make things really simple, you're gonna sit down at home, sit down on something pretty comfortable, and I'm gonna use my leg as an example. So I'm gonna put up my pant here, and so we're gonna be looking at what the knee is trying to do when you're flexing your leg. So what you want to be able to see, so this is gonna take some observation on your part, is you're gonna look at the patella, which is the bone, the floating bone here. And what you wanna see is as you contract your leg, the patella should move perfectly straight up. Now, what I've noticed, and I see this from time and time again, and this is why I'm making this video, is that people's patella actually goes to the right side, which is the default side, and that's the side that normally this is what happens. So instead of tracking straight up, it actually tracks to the side. This can also lead to something called a retropatellar pain syndrome, which is the patella is now compressing, and in fact, you're getting grinding or clicking when you do this. So all you're gonna do is, as you're sitting down, you're gonna contract your knee, and I wanna see what your knee is trying to do. Now, if you notice that the knee is literally coming out to the side, again, this is the typical thing that happens. What you're gonna wanna do in the exercise for this, and there's a few that we're gonna go through, but it really is to contract your leg, bringing it up. And what we want to do is activate this side, so the inside of your leg. This is called vastus medialis. So there's 4 muscles in your quads. This is the 4, but the one on the inside is the one that's weak. So you're gonna want to fix that, and you want to stimulate that. So how do we stimulate that? There's a few ways to do this. Bear with me, I'll just go through the top 3 ways. But what you want to do, this is an easy way. You're just contracting this way, holding and letting go. But what you're going to want to do is slightly turn out, almost as if you're playing soccer and you're passing the ball to somebody. You're not doing it from your toe, you're not punting it. What you're doing is you're using a little bit of the side, and you're going to stimulate the inside of your leg. So you're slightly and then holding for a few seconds, and then bringing it back down, holding for a few seconds, letting it down, and you would treat that like a regular exercise. So you do that 3 sets of 10, and then you give that a rest. It's rare that it's on both sides, but definitely check the other side, make sure that that's not the case. If it is the case, again, you're repeating the same thing. You're looking for that. So that's called patellar tracking, and we're working the medial or the inside vastus medialis. That's the muscle you're doing. Now, there's other ways of doing that one, and I could put this down to show you, but what you're gonna do is you could do a squat doing this, but you're gonna, instead of your toes being this way, now if you're elderly, if you're out of balance, or you're still getting the knee pains, you can use a chair to do this. But what you're gonna do is slightly turn your feet out, not even 45, I mean like 30 degrees. And from here, all you're gonna do is sit back. So if you have your arms out in front, you're sitting back and then back up. But it's the slight outwards that we're looking for. And that way you're stimulating the medial, the inside muscle again, and you're getting that stronger, which is gonna limit any of the type of pain. If you have one of these at home, then you can attach this to the base of a chair and to the base of your leg, and that's gonna create some resistance. So you can always go get yourself an elastic band. This is a really light one. There's different strengths to them, but you could go for a 5, a 10 pound. There's even a 15 pound resistant band. And these are great because they're versatile for all types of issues when you're trying to rehab or strengthen certain muscles. But you can use that in order to get more strength. If you really want to get even more strength, you could do the squat so this is just a rolled up towel, so you could use a towel. I'm gonna put it this way, and what you're gonna do is slightly outwards, again, and I'm pinching the towel as I'm doing the squat. So it's a pinch of the towel as I'm doing the squat. That's gonna make sure everything stays in line, but you're also, again, you're doing the vastus medial. And the last exercise or stretch that you're gonna do is an ITB stretch. This is also responsible for a lot of people's pain. They're gonna feel it on the outside of the knee. They could feel it down the side of the hip. It can even start in here. So this is the ITB, or the iliotibial band. What happens here is that the ITB attaches to the outside of the knee. A lot of people get the outside knee pain. ITB can also attach, or it does have a small amount of attachment to the meniscus, which actually causes a lot of meniscal pain. So if this is a chronic issue for you, we see it a lot in runners. So a lot of runners, especially at the start of the season when it's cold or a little bit more damp, and it's like that in between summer, a lot of they'll get the ITB stuff. You'll even notice it at about 20 to 30 degrees of flexion. You'll say, oh, that's where it really hurts. Generally, again, in that case, that could be an ITB. So this is where, again, it gets quite confusing for a lot of people. And this is where having the right person on your health team is strictly so important that you can actually get so much more or way better results instead of just doing stretches or exercises at home. But one of the things I always recommend people to do is the bowler's stretch, all right? So I call it the bowling stretch because it resembles the most of a bowler. So what would happen is, as a bowler's bringing the ball around, and they're bringing it, or they're throwing the ball down the course, they're usually gonna have that back leg out. So you'll see them kick out this way. Well, this is a really good stretch for the side. So I do recommend that you do have something that you can hold, that you can support yourself with. But what you're gonna do is bring that leg back. You're gonna roll onto the outside of your foot. Now, if you got ankle problems, that's probably gonna hurt a lot, so probably not a good one. I'll show you an alternative to this. But what you're gonna do is you're gonna make sure your knee is in the extended position, and then you're going to side bend your hip. Now, as you do that, you're gonna feel a deep stretch on the outside of your leg. Some people will use the wall or whatnot in order to support themselves, but the other way of doing that is on a table. So the ITB stretch can be done at home. You're gonna lay, so we're gonna do it, so you're gonna lay on the back side of your bed. So you're gonna make sure that you're as far back as you can go. This leg, so the other leg has to be flat. And again, there should be nothing behind you here. So you're really on the edge. Grab onto the side of the bed or something so at least you can hold on to it. But what you wanna do with this leg is extend the leg out. You can't, if you got a lot of ITB problems, even just doing this is gonna hurt. You'll probably feel it on the outside. But what you wanna do is bring your leg down, and then you can overpressure this way. So the leg is coming down. Generally, when you're laying down, you know you have a really tight ITB when as you lay down and your leg is coming back, you'll actually still see it in the air like this. That's how you know this guy's way too tight. So what you wanna do is bring this down, your hips are coming down with it, and now the weight of the leg is actually stretching that out. If you can roll it out as well, so if you have a rolling pin at home and you like to bake a lot, you can literally roll that out. Now that hurts a lot. A lot of athletes do that, but I find that most people don't enjoy that one at all, and it's way easier to get either the boulder stretch or the one on the side where you're just letting gravity do that. If you have somebody at home that can support your hip and push down on your leg a little bit more, then that would be a bit more of a deeper stretch and something that can help you. So those are the top things that I always see in clinic. It's the patella, or that middle bone is not tracking properly. It's causing a bunch of compression. It's causing the vastus lateralis, the outside muscle, to pull the knee over. You're getting the right side or outside knee pain. It can cause way more issues, ITB problems, hip problems, ankle problems. But as a chiropractor, there's one thing that remains the same, is that all these muscles get their information from the nerve, which actually comes out of your back. So if you got low back stiffness problems in the hips, problems in the ankle, and any other reason, then what happens is the muscles are simply reacting to the imbalances that are happening there. So having a chiropractor or somebody who can properly assess this, check this properly, and give you the right recommendation. I mean, even as a chiropractor, one of the best things I love doing is the knee adjustment. So we have different ways of distracting the knee, pulling that apart, taking the pressure off, and people getting immediate changes right there within seconds of getting that adjustment. If you have any questions, you can leave it down in the comments down below. But more importantly, go see a chiropractor. If you need help with that, again, leave it in the comments down below. I will do always my best to try and find you a chiropractor wherever you are in the world. And in some places, it is difficult to find one, but I want to do my best. I want to get you the help that you need. I'm Dr. Matthew Posa. Thank you for watching. Don't forget to like, subscribe, and share this information. And until next time, we'll talk to you later.